in a retirement home called The Villages in Florida that he visited a year ago. He sees them supporting him. They had banners, Trump 2020 and America First. But of course, many others are offended.
Meanwhile, reports have emerged that Russia was secretly offering Taliban militants money to kill US troops in Afghanistan. The New York Times and The Washington Post are both citing US officials who say a Russian military unit offered the bounties last year. Both Russia and the Taliban have both denied this, while President Trump says he hasn't been briefed on the reports. With more on this, here's CNN's Nick Payton-Walsh.
At this point, the European intelligence official I spoke to yesterday says that they believe this plot did result in harm to coalition soldiers in Afghanistan and that money indeed had been transferred. A US official speaking to my colleague Barbara Starr seemed to believe that transfer of money had also occurred. The US official did make the point that this occurred in about February and March of last year. There was discussion about what to do with this war intelligence, further verification occurring, and then, as we know, since about March or so, most US forces in Afghanistan have in fact been in base because of the coronavirus epidemic. The European intelligence official I spoke to called this GRU, Russian military intelligence plot, callous, shocking and reprehensible, and also asked why. What is the Russian motivation here? Are they trying to expedite the US withdrawal from Afghanistan by perhaps increasing casualty numbers? Well, President Donald Trump has been clear he wants out. He's been in negotiations with the Taliban to strike a peace deal. They picked up again some kind of momentum again today after stalling over prisoner exchange. So it's no really surprise that Washington's Trump administration wants out, frankly, more than anybody at this point. Whether this Russian plot, if indeed it is proven to have been as concrete as seems to be suggested, adds to that need to get out of Afghanistan, or in fact just creates another problem for the Trump administration in trying to do so, we simply won't know.
CNN's Nick Payton-Walsh there. Health officials in Victoria insist the latest outbreak of COVID-19 in parts of Melbourne isn't a second wave. They do say, however, that the numbers are cause for genuine concern, with just under 100 new infections detected over the weekend. The ABC's Rhett Burney reports.
With stay-at-home orders and suburban lockdowns still on the table for now, Victoria is relying on a testing blitz to try to contain several coronavirus clusters in Melbourne. It's a mammoth task that relies on thousands of workers, among them scores of paramedics who are volunteering their time.
So this is sort of out of the norm, but they are volunteering. They are putting their hand up to do it because, as one paramedic said recently to me, anything they can do that sort of brings this whole thing, the whole COVID pandemic to a conclusion, the better it is for everyone.
That's the Victorian Ambulance Union Secretary, Danny Hill. Ambulances have been parked on residential street corners and set up as makeshift testing clinics, which means staff are working extra hours.
Car accidents, heart attacks, mental health, mental illness, those things still happen, regardless of what's going on with the pandemic. So paramedics still need to respond to all those cases. There's just all these extra precautions now that they need to take.
As Victoria tries to prevent further transmission within the community, Australia's Deputy Chief Medical Officer, Professor Michael Kidd, said the case numbers are of genuine concern, but he has this important caveat.
This is not a second wave, and we hope that we do not come to the position of having a second wave of infections occurring within Australia. What we're seeing happening in Victoria is exactly what was planned when we have outbreaks occurring across the country.
Although Victoria's infection spike is mainly occurring in ethnically diverse and lower socio-economic areas of Melbourne, Premier Daniel Andrews says COVID-19 does not discriminate.
Rhett Burney in Melbourne. The number of deaths from COVID-19 across the globe has now passed 500,000. Just yesterday, the total number of positive cases reached 10 million, and the World Health Organization is once again warning that in many countries, the pandemic still hasn't peaked. The BBC's Terry Egan has this overview.
In the first month of this pandemic, near the beginning of the year, less than 10,000 cases were reported. In the last month alone, there were almost 4 million. And more than 1 million have been added since June the 21st. I don't want to blind you with figures, but last weekend saw the largest daily increase with 183,000 in 24 hours. And with some countries easing lockdowns and all the talk of cures and vaccines, it poses the question, what's going on? A quarter of the known cases are in the US and 1.3 million have been counted in Brazil. Russia, India and the UK have recorded hundreds of thousands. Governments are getting a lot of the blame. Here's Nancy Pelosi on ABC, referring pointedly to Donald Trump's approach.
Wearing masks, washing your hands, there is a way to do it. Instead of what the administration did, deny, delay, death, it's time for this administration to take this seriously.
That's cases. What about deaths? Around a quarter of those in the US, and now more than 100,000 in Latin America. And this is all before we start talking about a possible second wave.
A couple more facts and figures. In the month of June, one person has died with the coronavirus every 18 seconds. And in just 5 months, the COVID-19 death toll is equal to the number of people who die annually from malaria. Exit polls in Poland's presidential election suggest that the incumbent, Andrzej Duda, has finished first, but without the votes to win outright. Mr. Duda, a socially conservative right-winger, is projected to have won just under 42% of the ballots, compared to his main opponent, who secured about 30%. A second round of voting will take place in 2 weeks' time. Andrzej Duda is known for his destructive policies targeting LGBT rights. Starbucks will stop advertising on all social media platforms while it works with civil rights organisations to, quote, stop the spread of hate speech. The coffee giant joins global brands including Coca-Cola and Unilever, which have also recently removed advertising from platforms. The BBC's Beth Timmins reports.
Starbucks joins over 150 companies in choosing to suspend advertising on some social media platforms. It told the BBC it would have discussions on stopping the spread of hate speech and would still post on social media, though without paid promotion. The announcement comes after Coca-Cola called for greater accountability from these firms, pausing advertising on all social media platforms globally. Unilever, owner of Ben & Jerry's ice cream, has also paused advertising on Twitter, Facebook and Instagram in the US. It spent $850,000 on Facebook in the US alone in the first 3 weeks of June. Critics say Facebook has been too hands-off in its approach to moderating content on its platform. It said on Friday it would begin to label potentially harmful or misleading posts which have been left up for their news value.
The BBC's Beth Timmins there. France's Green Party and its left-wing allies have made significant gains in a second round of local elections. President Emmanuel Macron's centrist party failed to win in any major city. The poll was delayed in March because of the pandemic. Restrictions such as mandatory face masks remained in place and turnout was low. And finally, Russia is denying that a leak of nuclear material detected over Scandinavia came from one of its power plants. Nuclear safety watchdogs in Finland, Norway and Sweden said last week they had found higher than usual levels of radioactivity in the atmosphere. And that's World Watch for today. I'm Max Toll. Back to you, Marnie.
Thanks, Max. And that's Midday Report. Te Purongo o Te Potutanga for today, Monday, June the 29th. Stay with RNZ for the Health Ministry's COVID-19 update with Ashley Bloomfield shortly after 1. We'll have that live on air and online. We'll be back tomorrow, but for now, from the midday team, kia tau te mauri.
RNZ News at 1 o'clock. Good afternoon, I'm Paul Brennan. The number of people back in work after the lockdown has improved. Stats NZ says the number of filled jobs rose by a seasonally adjusted 0.8% last month on the previous month. In April, which included most of the level 4 lockdown, the number fell by 1.6%. The data shows women generally and workers aged 15 to 24 have had the weakest return to work, indicating they're more likely to be in casual or part-time work. The numbers include those in jobs covered by the government's wage subsidy scheme. The senior National MP Paula Bennett says her decision to retire from politics at the election is not a sign of lack of confidence in the party's new leadership of Tob Nulla and Nikki Kaye. Mrs Bennett was ousted as deputy leader and campaign chair in the leadership coup last month. She says she's taken time to reflect over the past few weeks and now is the right time to pursue another career. But she says that's not a reflection on the new team at the top.
No, not at all. I mean, I think the new team are there. I think they've got a really good shot at it, and it's time for me now to put me first, and I think that means a new career.
Todd Muller has thanked Paula Bennett for her service to the party and New Zealand. He says that as Climate Change Minister, she signed the 2016 Paris Climate Change Agreement, and as Social Development Minister, she reformed the social welfare system, helping thousands in the aftermath of the global financial crisis.
Kia ora koutou katoa. Welcome to the Ministry of Health, and thanks for attending the update today. So today there are 2 new cases of COVID-19 to report once again. Both have recently returned from overseas and both are in managed isolation facilities. There continue to be no cases to report from our community. Both of today's cases have been in managed isolation since their arrival, and their addition brings the number of active cases in New Zealand to 22. All of whom are people who have recently arrived from overseas. And both are now in a quarantine facility in Auckland. A little detail on both the cases. The first case is a man in his 50s who arrived in New Zealand from India on the 24th of June. His result came as a result of day 3 testing while he was in managed isolation. The second case is a woman in her 20s who arrived in New Zealand from the USA on the 18th of June. She is the wife of a previous case who tested positive on 22 June and was already in the quarantine facility as she was considered a close contact. As you know, globally, the COVID-19 pandemic continues to accelerate, and as I've said before, we've always expected new cases amongst people coming back to New Zealand. This reality was reinforced in a weekend update from the World Health Organization, which noted a record number of cases in the preceding 24 hours, over 189,000 cases recorded. And you'll be aware also that the number of cases worldwide has now exceeded 10 million. Our strict border controls, in particular, the 14 days required in managed isolation or quarantine, ensure that all arrivals are managed to the world global standard and with appropriate public health protocols, and are isolated from other New Zealanders while they are or may become infectious. Just to further numbers, we have 1 person in hospital, as reported yesterday in Auckland City Hospital. This person is stable on the ward and does not require more intensive care. Our total number of confirmed cases is now 1,178, the number we report to the World Health Organization. And yesterday our laboratories completed 2,574 tests on Sunday, and the total number of tests is now 395,510. That testing includes our testing both at managed isolation facilities and our community-based testing. We're continuing our progress with contacting people who have left managed isolation facilities between the 9th and the 16th of June. 1,269 of these people have been contacted and have tested negative for COVID-19. That includes the 800 who were tested prior to their departure. There are still 367 people with whom we are having trouble making contact, not for want of trying, with text, where possible email and repeated phone calls. And I would ask that those people who have been in a managed isolation facility and who have received an attempt to contact them, of course, and who haven't yet spoken with Healthline, to please call the dedicated team on 09 302 0408. And as needed, we will refer people who do not make contact to our finding services, and if we feel necessary, to enforcement. And finally, the New Zealand COVID Tracer app has now recorded 584,000 registrations. I do want to continue to encourage people to not just download the app, but to use it to scan in on the QR codes that many premises now have. And one of the things that is particularly valuable with the app is it provides our contact tracing service with up-to-date contact information for people who have registered. So please do, if you haven't downloaded that app, please do so and make sure we have your updated contact information should we need to be in contact with you. I'm open to questions.
The man in the hospital, it was reported yesterday that he was taken to hospital after he developed symptoms last night. How do you go from having no symptoms to requiring hospital-level care? Sort of, was there an oversight there, or what happened?
So my understanding is that his symptoms were possibly related to COVID-19, but could also have been related to a pre-existing condition, and it depends on the severity of the symptoms. We do know that some people will develop shortness of breath and chest pain, and of course in that sort of situation we want to rule out other diagnoses, for example whether it's a cardiac problem or a pneumonia that's developed. So he was tested, the hospital knew that he was coming from a managed isolation facility. He was tested as part of his assessment, and his symptoms are being treated. He was found to be positive on that testing at hospital.
What was your reaction to the report out yesterday about the border?
Oh, well, what I would like to say is right through our response since the start, you'll know we've been reviewing various elements of our response. For example, our response in aged residential care has had a thorough review by both myself, the Ombudsman has done some work, and the DHBs went around all the facilities in their area. And we've also had our PPE supply and distribution reviewed, and likewise we had the independent review by Dr. Verrill of our contact tracing work, and a contact tracing advisory committee was set up as well to provide ongoing assurance. So this is the thing about the health sector, it's a core part of our work is to keep reviewing what we are doing so we can strengthen and improve, particularly in a situation where we are learning all the time. So, look, I welcome the review that was done, and we worked closely with my counterpart, Air Commodore Webb. There are a number of recommendations in there that relate to the health aspects of managed isolation. I would also say that we had a team on the ground last week in Auckland, including someone from a clinical background and our internal auditor from here, and another senior manager who did a full review of all the more in-depth review of all the health parts of managed isolation. So again, constantly trying to review, improve, and ensure that we're providing the best possible, health care and testing regime as part of that.
And we'll find in the results of that review part of the review that was released yesterday, or are you?
We did it separately. I've got some draft recommendations, but what we did was sit down and just see what it was that was coming out of that review. The report's being finalised this week, and of course that will inform alongside the broader review that was commissioned by the Minister of managed isolation.
When can you tell us the results of that review?
When I've received them, I've received a draft. I've seen a draft report, and what I wanted to do was to make sure the team was considering our response to that alongside the response to the wider review.
One of the recommendations was an urgent review of the PPE from start to finish of someone's journey into managed isolation. Is that something that is happening now, or will start soon?
Well, actually, we've sort of taken action on that already. I talked yesterday with Air Commodore Webb, and you may have heard him this morning in his interviews talk about. So he and I are taking the approach that we should implement from aircraft to hotel room, people should be wearing a mask, and it's the mask in particular, of course, good hand hygiene about the mask. So we're implementing that, and also some other aspects of when people are outside of their room in common areas or in reception areas to be using masks as well. So
and how does that work with the sort of Ministry of Health? Are you supplying the masks, or is it airlines, or sort of where is this stock coming from?
Yes, so for the managed isolation process from when people, in a sense, exit out of the airport through to when they finish their stay, that PPE is available through our health PPE, so they're able to, the hotels are able to access it through the local district health board, so we've got good mechanisms in place for that to happen.
So it's the national stockpile that is essentially...
Yeah, well, it's our national supply. So there are two sort of supplies. There's the health system related supply, which has now been significantly boosted, and we've got the national distribution on that. And then there's a parallel process to supply other government agencies like Customs and MPI, folk who work at the border. They will access that through that parallel store. But in terms of managed isolation and quarantine, that the PPE there is accessed through our health stockpiles, which is substantial now. So there's a question.
I'm just wondering what sorts of masks they will be, what sort of PPE you're talking about.
Yeah, so the mask will be a standard surgical mask for people who are in the facilities, and for other staff in the facilities, aside from our health workers who are doing assessments and swabbing. Swabbing requires fuller PPE, including an apron, gloves, goggles or a face shield, and what's called the N95 mask. Anyone doing swabbing does that, but otherwise for other staff and guests it will be the standard surgical mask.
Do you have a sense of where people who are coming from overseas are picking up their COVID? Are they picking it up on the plane or before they hop on?
Well, the fact that we're identifying people in that early testing, the day 3 or around day 3 testing, suggests that they are being infected in their country of origin. And all those cases that we've seen, we can trace back to the fact that they've come from a country where we know there are high rates of infection, like the US of A, the UK and India and Pakistan, where all of our people have originated from over the last couple of weeks who have tested positive.
Could airlines require a test before people board, or could they require 2 weeks of isolation before people board the plane?
Well, it's possible but it's usually governments that ask that to happen rather than the airlines per se. So, for example, many of the Pacific Islands currently require someone to have had a negative test within 2 or 3 days of travelling before they go to that Pacific Island, and then they usually are required to do the 14 days self-isolation, managed isolation as well.
So just going back to the managed isolation report, were you told by health officials that they didn't have the capacity to do day 3 and day 12 testing, and you pushed on with the policy anyway, or were you not told that they didn't have the capacity to do that?
Well, the policy was being implemented from the 9th of June. The intention was to start first with the people who were around day 12, because they were the people who were going to be leaving managed isolation. Remembering, and as I've said a number of times, this is complementary to the ongoing 14 days of managed isolation. The capacity was worked up, but once again, when we found that there was a gap between the policy intent and the implementation on the 16th, we moved quickly to make sure that no one left without the test, and then to do the catch-up on the day 3 testing as well.
The review says, though, that officials were never going to be able to fulfil that request to do the day 3 and day 12 testing, so why wasn't something done about it sooner?
Well, they may not have been able to do it immediately, because they would have needed to. It's quite a significant exercise to swab everybody on day 3 and on day 12. And as I've covered before, there was a gap, but now we've filled the gap. And so since the 16th, we have now clearly caught up on both the day 3 and day 12, and people haven't been leaving managed isolation without that negative test. And I think what we're seeing now, of course, over the last week is the positive tests are coming through largely on that early testing, although it's not in itself fail-proof either. It needs to be complemented with the ongoing daily symptom checks, which were already happening, and the 14-day managed isolation period.
Are you confident in the current processes in place for New Zealand flight crews returning from overseas and international flight crews coming over here and having an overnight layover at a hotel where other people, members of the public, can also stay? Are you confident in that process?
I am confident in the process. However, we are also working, and I've been talking with Air New Zealand, including with the Chief Executive, and I'm meeting him tomorrow, about what else we can do, not just to keep their crew safe, which is of course of major concern to the airline and the crew members. They do not want to be putting themselves or their families at risk. So just to make sure we've got that as tight as possible, and part of that is the move to having masks available for and provided for passengers coming across from Australia. And we are doing an audit of the process that is currently in place for other international crews who come in and have a stopover before flying back out on their flight. So we're constantly looking to see how we can improve and strengthen the process.
Would improving that process be putting those international air crews who don't have to go into isolation for 48 hours like the domestic crews do, putting them in isolation quarantine hotels like other overseas arrivals?
Not at this stage, no. What we've done is identified that of all the places that the air crew who fly international routes go to, The USA is the one that has got a slightly higher risk. We actually sent someone to Los Angeles to do an audit of what happens there, and I'm waiting to see the final part of that report, but my understanding is everything looked very good and tight, and we have introduced that those crew coming back on that route do isolate at home for 2 days and then are tested. Again, just pointing out, the last thing they want to do is infect their families or put their families at risk. So we're constantly reviewing that and in regular contact with both Air New Zealand and the organisation that represents all the airlines.
Can you give us a bit more detail on what that person you sent to the United States to look at that? When did that happen? What does that involve?
I'm sorry I don't have any more detail, but maybe I'll cover that either tomorrow or the day after in my update. I'd be happy to. Yes.
One of the documents that was released on Friday was a report to Cabinet, those weekly kind of COVID-19 updates that they were getting.
Yes.
It was the last one in late May that warned that by mid-June the country would have problems or could be having problems with its international supply of medical equipment into the stockpile, including masks. Has that been dealt with?
It has. We've got really good stockpiles, and of course, with no community transmission and being an alert level 1 in the country, that means that we have not got the same level of use of or demand for PPE out in the community. So most of our PPE now is being used either in hospital settings where they're assessing people who have got or at high risk, or swabbing out in general practice or in the CBACs. And of course now in managed isolation, but we've got very good stockpiles, and I'm happy to provide an update, and I can do that again in the next day or two around where our stockpiles are for PPE.
Right, well, so that's the demand side, but the report was warning about the supply side, just saying that those international supply chains might not be there by mid-June. So that's what I'm wondering, if those supply chains were reestablished or altered.
Yeah, well, I'll get an update on that. We have. My understanding is, and we've got a team working on this, that we've got good good stocks and good supply chains, and of course our new national distribution system.
It's taken about a week to contact, or you still haven't been able to contact about 367 people through that airline thing. Does that undermine confidence in our contact tracing abilities, given that we can't get in touch with them?
Well, I think it shouldn't undermine confidence in our contact tracing capabilities, because we have really good capability and capacity. What it does emphasise is that, as we did through lockdown, everybody needs to play their part. And yes, we can have contact details and repeatedly contact people, but there is also an expectation and I would have thought an obligation on their part to make contact back. I have now for some days been encouraging people who haven't yet spoken with Healthline and who were in managed isolation to do so. So I think, again, there are two issues I think that have presented, and I've talked about them with my colleagues all of government. One is about ensuring we've got really good contact information. And the system we've put in place to match people's national health index when they come in, and the single sort of database for when people go through managed isolation, and ensuring we've got really good contact information will help. But we also need to just remind everybody, including those recently returned, they have a role to play, and just as we did when people were self-isolating at home, it requires people to play their part.
So what's the next step on that though? So, I mean, you've mentioned before finding services, which is mostly customs and I understand police if needed. So what's the next step if these people continue to sort of ignore these pleas to get in touch with Helpline?
Yeah, so we'll make a decision around that. But what I do want to emphasise is now all of these people are people who have completed their 14 days and had completed that before the 16th. So we're now nearly 2 weeks down the track. We have, of course, tested many of them, and that's encouraging. And we have done significant testing out in the community, and we are not finding any COVID-19. These people present a very low risk. And so the question will be whether or not we still need to follow them up. My simple request to them is to make contact through that Healthline number, and then we will be able to tick them off and know that we have tick them off in a tick sense, not tell them off sense, but to say that we have been able to. And that, I think, is an important part of us providing assurance to the wider public.
How frustrating is it that you have been able to contact these people? It's quite a large number.
Yeah, it is frustrating, and as I say, it's not through a lack of effort on our part. A large number of calls, text messages, emails, if we can. So again, I think it's just emphasising the fact that this is a sort of there are mutual obligations here, and that's really important for our contact tracing, is that people actually play their part.
And what is that threshold that you're thinking of when you will get police goes through your mind in terms of the requirements before you do it?
Well, I think it's less of an issue here because these are people that completed the 14 days. We were particularly keen and we focused first on those 55 people who had not completed the 14 days and were given permission to leave early because of compassionate exemption. So we focused a lot of effort, including using our finding services to go and find the one or two people towards the end who we hadn't been able to track down.
But there have been reports of people who called Healthline with symptoms for, flu-like symptoms, were referred to go to their GP to get a test and then being charged for that test. And GP is now saying that there was some sort of rule change from the Ministry of Health that means that they'll now be charging for them. Is that something that you've heard? And could you sort of illuminate what's going on there?
So I can be really clear here. There has been no rule change around charging. So having a COVID test should be free. Whether people are getting it at a CBAC or at their GP, and we have agreed a payment to general practitioners to cover the full cost of any assessment if required and of doing the swabbing. So we'll make sure that is clear. I know the College of GPs is sending a message out to GPs today. We'll make sure it is clear there, but people should not be being charged a co-payment for a swab for COVID-19 or for the consultation around that.
There's been also an editorial in the New Zealand Medical Journal last week from 7 public health experts saying that masking is the way to avoid a second lockdown in New Zealand. Have you had a chance to read that? Do you have any thoughts on it?
I haven't read the editorial, but I can assure you that the public health experts have let me know what their views are through other channels, and I think that they've been widely communicated. There is no doubt that mass masking may play a role should we get community transmission again, and if we're trying to break that community transmission to help us avoid having to go up through the alert levels again, and particularly in confined places. And that's one of the reasons, for example, we are now requiring the use of masks or asking people to use masks when they are travelling on aircraft into the country. I think that most of those public health experts also agree that given we do not have community transmission at the moment, there is no particular reason to ask people to use masks routinely. One of the arguments is that can start to essentially normalise and or get people used to using masks. Again, I think that there are other more important things we can and should be doing at the moment than mass masking, but it's certainly not off the table.
Do you have plans and capacity to be able to roll out, if there is suddenly sort of a case of tomorrow's community transmission, to roll out masks at public transport stations or crowded sort of venues and that sort of thing?
We are doing across government a look at sort of planning for if there was a resurgence. It wouldn't be an early thing. Again, the things that will be the most important will be those basic public health precautions, including the social distancing. And even in countries where they are recommending wide use of masks, where they have higher rates of community transmission, it is complementary to those other fundamental aspects of the public health response.
Is it good enough to rely on mutual obligations for contact tracing when over 360 people have essentially proved that they can't be trusted when it comes to contacting health officials?
Well, I'm not sure if it's a lack of trust on their part, but the message may not have got through. What I would say is, if you think about the success of New Zealand's response to date, and in particular the extent to which New Zealanders lent in and did what was asked of them through lockdown, and therefore we were even more successful than we thought we might have been. It is not because we had police on every corner or in every household, or the threat even of that. It was because people understood the why and they did what was expected of them and cooperated. This is what I'm asking for here, and I think most New Zealanders would think it's a reasonable expectation for these people to cooperate.
Would you recommend that airline crew wear masks when they're out in the community in New Zealand?
If they've come back from internationally? No, not necessarily. I do know, and again I spoke just this morning with the Medical Director of Air New Zealand, they have really well tried and tested procedures. It started when we did that first evacuation flight out of Wuhan, and remembering also that the crew who were on that flight were volunteers. This is at an early time when we knew very little about the virus and the pandemic. So they have a very strong interest, the airline and the staff, in making sure they are protected from COVID-19. We have added in this requirement for the 2 days self-isolation and negative test for the ones coming back from Los Angeles, but I don't think there's any reason why they would need to be wearing masks around the community.
On the to go back to the contact tracing or the tracing of the 360 people. So was it because that the system depended on them having a valid number with the NHI number? And were they asked to provide any other sort of follow-up email address or contact number?
Yes, so the latter is the case. So we have contact information for them. So there is over 360 who we have been able to contact and have left messages, and text messages have got through, but the contact has not been returned. There is also a number now in the 50s that the contact information, for example, phone numbers didn't work. Now, this will largely be because these are people who have maybe been overseas a long time, they've returned to New Zealand and their phone number was an overseas number, and they may well now have a New Zealand SIM card. That's where we can use finding services through customs and police to see if we can find other contact information for them. Just a couple more questions, probably.
If there was a community outbreak, could we expect to see? I mean, in Melbourne, for instance, the health workers are going door to door. They've got the army involved, but in a lot of the rest of the country, life seems to be pretty much as normal. Is that what you would expect, just in a very intensive local effort, or what's the kind of plan?
So yes, it may be local, and we would expect that if there was community transmission, it would be localised in one or maybe a small number of regions, and that's where we would want to bring our testing capacity really to bear. You know, if you recall back to Alert Level 3 and 2, when we were doing that wide community testing, and actually we did it right across the country, but the DHBs were able to scale up the swabbing, including with the use of, for example, mobile units to go out and make sure that was available. So that's exactly the sort of approach we would use, is that wide testing to identify any sort of undetected cases.
And how confident are you that you could stamp it out?
Oh, very confident. We've done it once, yes, with the assistance of a lockdown. But remembering we've now got all the those key elements in place. Should we get cases that do come through the border, that we've got the testing capacity and we've got the contact tracing capacity to be able to do.
What's the likelihood, in your view, that there would be an outbreak somewhere, that you're not going to be able to just isolate it at the border?
I can't speak to the likelihood. I can't put a figure on it, but this is a long game here, and it may well be that for whatever reason we will get cases again in the community, and that's why we've got our really good testing capacity, our very good PPE supplies, our DHBs have got good preparedness plans, and also that we've scaled up our contact tracing system so that we can deal with cases and do the contact tracing if we need to.
On that testing capacity, as the virus as the pandemic grows overseas and as we ramp up testing at the border, how secure is the pipeline of the supply line of testing?
Very good, actually. We ended up with, I think, around enough supplies to do around 250,000 tests. Right. But I can provide, again, I'll provide that number tomorrow of what our current supplies are onshore. That's end-to-end, including swabs, right through to the reagents.
And that's just sort of like a rolling buffer there that we continue to import, and we've had no issues recently in terms of our ability to import that material.
We built up quite a good supply, and we've got those supply chains now working well.
In terms of the man who's hospitalised, I was just wondering, I want to follow up. Do you know whether or not he disclosed any symptoms before the ambulance was called? Because he did go from managed isolation, where you're not supposed to have symptoms, to the hospital. So that's kind of the odd part of this, right?
Look, I don't know, and I think, again, what I can say is everybody is checked for symptoms every day, but it may well be that the symptoms he had were actually unrelated to COVID-19, but that it was felt warranted that he was assessed at hospital. As part of that assessment, rightly, and they treated him as if he was positive, rightly he was tested and found to be positive, so it's been managed as such. But I don't know enough about, and I wouldn't be wanting to talk about his personal medical condition here in a public forum. Final question?
Any updates on compassionate exemptions and when that will be reinstated, or if it even will be?
It's an active discussion, and we are looking at what we would need to have in place to be able to restart that process of compassionate exemptions, and that's work in progress.
When do you think that might be?
I don't have an indication of the timing. Thank you very much.
Have you received any flowers yet?
I've received some flowers. Thank you very much.